Subscribe to Swarajya and press the bell icon.
The GDP numbers for the April, May, June quarter are out, and there's a contraction of 23.9%. And now everyone is asking the question, the one important question: why did a nation of 1.3 billion people go for a lockdown if the eventual consequence was going to be a contraction of this scale, of this magnitude? Today, in this episode of Standpoint, we'll be looking to answer that question, that if the India's COVID lockdowns were a mistake by the Modi government. Now, it's not a very easy question to answer for simple reasons. If you've lost someone very close to COVID-19, of course, the lockdowns were warranted for you, but they were not good enough to save your loved ones. If you're someone who's suffered from unemployment, if your business has been shut, for instance, a hotel or restaurant due to COVID-19, the answer is maybe the lockdown was too harsh on you. If you're someone who's lost someone close to you and even your business to COVID-19, there are no answers. So it's a very complicated question. It's a very difficult question to answer, that were the lockdowns a mistake. Nevertheless, we'll make an attempt. But first, the number, the absolute number. If you go by year on year for the same quarter last year, 2019-20, the drop in GDP is rupees 11.1 lakh crore. Rupees 11.1 lakh crore. Now, if I go by absolute numbers, the deaths are around 65,000 in India. It's time for some insensitive algebra here. If you divide the amount the government could have paid the family of each member who died due to COVID-19, unfortunately, the government could have given around more than 1 or 10 crores rupees. If you multiply the number of dead people by 10, a wild assumption that if 650,000 people had lost their lives in India, 650,000 people, even then the government could have spared a lot of money. That's the insensitive maths I'm talking about. Not that the government should have done it, but that's how big the loss is. And that is why everyone is asking the question that April, May, June, 23.9% contraction, which will be seen again, not on the same scale, but a contraction will be visible in July, August, and September as well. Was it really needed? Now, I look at 4 factors to answer this question. Again, it's not an easy answer, it's a subjective perception, but nevertheless, we'll make an attempt. Let's go back to March. This is the first factor. Let's go back to March. We are seeing the rise in cases, a swift rise in cases in Italy. We are seeing the stories coming out of New York. We are seeing very sad stories coming out of China's Wuhan. And suddenly, the lockdown seems to be the most obvious option. Already, the Chinese PR is already in action, praising the Chinese government for what they've done in Wuhan. So the lockdown seems a very obvious choice. The Prime Minister, he comes on TV and tells the nation about how dangerous this virus is. And immediately everyone swings into action. The masks come out, the sanitizers come out. But April, it's a holiday. The business are also ready to take a hit for 1 month because for the greater cause. Come May and troubles start increasing. The cases are still rising. June, the cases continue to increase even if we start unlocking. July, August, and now September. So clearly what the government wanted to do was to create a lockdown to flatten the curve, to decrease the number of cases. None of it happened. But at that point, go back in March, the government was working in the dark. And when you work in the dark, it's always good to err on the side of caution. At that time, the Congress government, which today is criticizing the BJP government for the contraction in the economy, they wanted a lockdown. They wanted a lockdown to come in the first week of March itself. So at that time, a lockdown seemed the most feasible option. The second factor, the WHO. Now, we've all realized the uselessness of the WHO when it came to a pandemic, their closeness to China, and all those things. We've debated them, we've discussed about them. But even the WHO had no clear idea how to fight the virus in March. They were not even ready, or they had no acceptable answer as to one should wear a mask or not. And that was until June. So in March, even the WHO wasn't prepared to guide any government of any nation, especially a nation as big as ours, as to how to go about the COVID-19. Should the economy be open? Should it be closed? So at that time, even the WHO wasn't of much help, even with terms of the vaccine. Even if we thought some injection or some magical vaccine could have appeared in May, the government, at least at that point, hoped so. It did not happen, of course, but that was the thinking then, that something might come up which curbs the spread of the virus. That was the thinking in March, which justified the lockdown further. Number 3 was, a best defense against COVID-19 was prevention. Our healthcare facilities were in shambles. We were not making any personal protection equipment. We started making them after the lockdown, and we did a phenomenal job. Of course, that's one success story of the textiles ministry, safe for another day. But we did a phenomenal job when it came to the PPE kits. But our healthcare facilities were in doldrums. The hospitals needed to be designated in rural regions. Some governments did a tremendous job, state governments that is, that of Yogi Adityanath, some in Karnataka. Even Kerala started off well, but lost its way later. Tamil Nadu started off well, but again lost its way later. Some governments did do anything at all. For instance, Maharashtra, for instance, Delhi, which waited for the center to come in. So those 45 days of lockdown was very important to take account of all the healthcare facilities that were available in India. And that was done. That was more or less done with the exception of a few state governments where the center had to then step in, as we saw in Delhi. That's the third factor, why the lockdown was important. The fourth one was that the culture, the politics of a country is such that we cannot put livelihoods before lives. Now you go to USA, the Donald Trump press conferences that used to happen every evening. He used to be very vocal, very unapologetic about the idea of opening the economy, even if it led to a number of deaths. Go back to April, May, June, when New York was going through its toughest phase of the COVID-19 crisis. They were running out of ventilators, which they had to source from China, the same country Donald Trump used to criticize in every press conference. Even then, Donald Trump said that he wanted to prioritize the economy. Now, can an Amit Shah do that in India? Can a Narendra Modi do that in India? In hindsight, it's obviously easier to comment that, oh, this could have been done, that could have been done. We could have thought better about the economy. But at that time, the government could only think of the obvious, and that was to save lives. Because the one number the government did not have was that of India's recoveries. No one could have imagined that India's recovery would be that great as compared to the rest of the world as we've seen it now. Of course, the number of deaths are huge, but compared to the number of cases and comparing the number of cases to the population, India has done a phenomenal job, but the government had no way of anticipating that back in March, April, or even May. So that is the four factors why the lockdown was warranted. Now, the lockdown happened. This is what justifies the lockdown. There are lessons also that in the future, the central and the state government policies should be formulated in such a way that encourage working together, because a lot of economic crisis was aggravated by the state imposed lockdowns, which have been removed with the Unlock 4 guidelines. These are few lessons like the center state policies, the preferring of livelihoods over lives in the larger scheme of things. For instance, we do not have to shut an entire district down. You shut a containment zone, the isolation. All these lessons have come. But again, was the lockdown a mistake? In hindsight, one can easily say, oh yes, the lockdown was a mistake. But at that time, no, it wasn't. The lockdown did not think like a mistake. Now, every day you will get numbers like 75,000 new cases, 80,000 new cases, 90,000 new cases. And as we touch December, the number may rise to 1 lakh 2 as the metros open, as educational institutions open. But there is one other number we also need to now start factoring in now that we are in the middle of this COVID fight. That of the recoveries. Just yesterday, 78,000 cases were registered. What are the recoveries? Because this is one number no one is coming at. For every new person coming to the hospital with COVID-19, we also have to look at the person leaving the hospital cured of COVID-19 so that we get a complete picture of the COVID fight in India. We cannot say that India has 3.56 or more than 3 million active cases right now. No, those are the total cases. The number we need to look at is the total active cases, which currently stands under 1 million. And this is a nation of 1,300 million people. So take those numbers into account. So overall, yes, the lockdown has caused great economic pain. It has caused great unemployment, that which will take at least 3 quarters to reverse, as we've discussed in various articles on Swarajya and various videos before this. But was the lockdown warranted? It absolutely was for the first 45 days. And after that, the government has gone into an unlocking spree that just needs to be continued in the future so that the economic pain, the June quarter economic pain can be eased and we can start seeing positive year-on-year growth from the third or fourth quarter of this financial year. In hindsight, again, it's easier to say things, it's easier to make the numbers, it's easier to make the judgments. But when you're in the dark, it's always good to err on the side of caution. And that is what the government did with the lockdowns. Thank you.